My name is Esther. I'm a nursing student at Bellevue College, and this is my video for medication administration for subcutaneous, and I am. Cool. All right, I'm in the med room. First thing I'm going to do is my hand hygiene. I'm looking at the MAR. I'm figuring out what medication my patient needs and when. Looks like my patient needs 2 medications at this time. My patient needs Toradol and NPH insulin. I'm going to put on some gloves. So the Toradol has already been drawn up, and it has a label on it. The label details what medication it is, and it's Toradol. The label details the number of milligrams in this medication, as well as the number of milliliters that were drawn up, and the fact that this medication, the concentration that was drawn up at is 15 milligrams per milliliter. So the milliliters is 1.3 and the milligrams is 20, and confirming on the MAR that my patient is supposed to get 20 milligrams. So that is correct. My initials are on here. The date today is on here. The time is on here, and the expiration date of the vial is on here. The expiration date is 8/26/2026. So well before it expires. I'm delivering to patient room number 3 to patient name. Patient name is Mary Smith. Excellent. So this is correct. It does have a blunt needle on it right now, and I'm not going to inject with a blunt needle, obviously. So I'm going to open this package. I'm going to undo this blunt needle. This blunt needle immediately goes into the sharps, and this new needle, this IM needle, goes on. Cool. And it is correctly filled. Awesome. So next thing to drop is insulin. The NPH insulin, I'm going to draw up. I'm going to pop the top off of the vial. I'm going to open the alcohol swab and rub. As I rub for 30 seconds, I'm going to think about the nursing considerations for both of these medications. The nursing considerations for Toradol is I need to make sure that my patient isn't experiencing any GI bleeds or ulcers. I'm also going to check to see if my patient has any allergies. Patient has no known drug allergies. Excellent. I'm also, for Toradol specifically, I am checking my patient's kidney functions via labs of BUN, creatinine, kidney function labs. All of that looks good. So I will reconfirm with the patient that they do not have any history of GI bleeding or any current symptoms of GI bleeding when I'm in the room. All right, so the medication route and dosage for the insulin is subcutaneous, and that is 7 units. So I'm drawing up enough air to 7 units. I am now at 7 units of air. I will uncap. This is now dry. Air to air. Tip. Come back. And 7 units. Looks good. Holding up to the light to look for air bubbles. Tapping to get rid of air bubbles. Excellent. Air bubbles are gone, and I am at 7 units, a little above 7 units actually. So then I will put down, and I will come out. There we go. Right at 7 units now, and I can see insulin at the tip. So I'm not going to recap this needle. Hand behind my back. I'm in. Cool. Cool. And I'm in. Excellent. Now I'm going to write down that it's insulin and pH. My nursing considerations for insulin would be I need to check my patient's blood glucose. It looks like we just took their blood glucose. The blood glucose is 194, so they need a slightly corrective dose of insulin as well as correcting for the meal that they're about to receive. So the amount is 7 units. The route is subcutaneous. Added by, then put my initials on here. The date, this date, the time. 0900 right now, and both of these meds are due right now, so excellent. That's why I'm giving them right now. The expiration date for this vial, 8/26/2026. So, and again, this medication is supposed to go to Mary Smith, as indicated in the MAR, room 3. Excellent. Cool. Okay, again, I said the patient has no allergies. Great, cool. I'll put this label on the insulin. Excellent. Okay, I'm going to take off my gloves. Do hand hygiene because I always do it when I take off my gloves. Cool. And I'm going to pick up these meds and I'm going to walk into the patient room. Cool. Knock, knock. All right, I am now in the patient room. I'm going to close the screen, provide some privacy. Hi there, my name's Esther. I'm going to be your nurse today.
Hello.
What's your name, my dear?
Mary Smith.
Hi, Mary Smith. What's your date of birth?
1197.
1197. Excellent. That lines up with what is on the wristband and what's on the MAR, so that works out. All right, you're going to get 2 medications today. You're going to get some insulin NPH, and you're going to get some Toradol. The Toradol is going to be an intramuscular shot, and the insulin is going to be subcutaneous. Do you care which one goes first?
No.
Okay, then let's do the subcutaneous insulin first. Okay, for insulin, you don't have any allergies, do you?
No.
Okay, just while I'm here, do you have any pain right now?
Yes.
On a scale of 0 to 10, where's your pain at?
7.
7? All right, I'm going to raise the bed up. All right. Any history of GI bleeds?
No.
Any history of ulcers?
No.
Got it. And that blood glucose was recent?
Yes.
Excellent. Cool. I'm going to raise this up so it's easier for me. Cool. I'm going to do more hand hygiene. I'm going to put on some gloves. We're going to talk for a second. Okay. So you've gotten insulin before?
Yes.
Okay. So if you start feeling like shaky or diaphoretic or just like not with it, I need you to press your call out. I need you to tell us, okay? All right. We'll be back in about 1 to 2 hours to check your blood sugars, and you'll have your food well before then.
Okay.
Cool. So this insulin that you're getting is for both to correct your 194 blood sugar as well as to offset the food that you're about to eat so your body can actually absorb those nutrients.
Okay.
Okay. I'm going to go through my 5 rights. Right patient, Mary Smith. Right dose, 7 units. Right route is subcutaneous. Right time, it's due at 9 o'clock. It is 9 o'clock. Right patient, right dose, right route. Right medication, it's insulin and pH. And right time at 9 o'clock. Cool. Cool. I'm now going to wristband and scan the medication. Excellent. Cool. Do you have a preferred site to use? Your abdomen? Great. For video purposes, since we're obviously not going to actually be injecting students, we have these cupcake-looking devices that we're going to be injecting into. Cool. Put that on your abdomen. Cool. Where was the last place you received a dose?
My abdomen on the left side.
On the other side. Got it. So I'm inspecting. I'm making sure that the area is all good, and it's not where you last received a dose. I'm going to rub. Looking good. Okay. I'm going to let that dry. Because this is about 1 inch, I'm going to squeeze and inject at a 45-degree angle. If this were more than 1 inch thick of subcutaneous fat, then I would actually be pulling the skin apart. Okay. All right. It's dry. Cool. Take off the cap. I'm going to squeeze at a 45-degree angle. At a 45-degree angle, 3, 2, 1. Inject. Draw out. Immediately do the safety feature. Safety feature engaged. Assessing for bleeding. No bleeding. Looking good. And this would immediately go in the sharps. Cool. All right. All right. As I said, we're going to come back in like an hour and a bit. And between an hour and 2 hours and recheck your blood sugar one more time. Cool. Okay. So for the Toradol, we already ascertained that you're in 7 out of 10 pain. We already ascertained that you don't have any GI bleeding risks at the moment, which is great. Good work. Keep that up. Cool. So now we're going to go through the medication rates for the Toradol. It's the right drug. It's Toradol. It's the right amount. It's 20 milligrams or 1.3 milliliters. It's the right route. It's intramuscular. It's the right time. It's 9 a.m. and it's the right patient. Mary Smith. Good. Scan your wristband. Scan this. Excellent. Gonna grab a new alcohol swab. Come up. There are 3 places that I could put this. There are 3 places that I could put this. I could put this in your deltoid. I could put this in your thigh, in the vastus lateralis, or I could put this in your ventral gluteal. Do you have a preference?
My deltoid.
Great. I'll put it in your deltoid. But before I put it in your deltoid, I'll just show you the other places that I would put that I would put it. Cool. For your vastus lateralis, I would go on your greater trochanter and just above your knee and the top third here. Flex your leg for me. Yep, cool. I can feel that muscle activating. It'd go right in there. Cool. For your ventral gluteus, I'm going to put my palm on your greater trochanter. I'm going to spread my index and middle finger apart, putting my index finger on the iliac crest and the other finger on the iliac spine, and it would be right in here. Can you flex your hip for me? Good, cool. I can feel it activating, so that is where it would go. But you want it in your deltoid, which is great. I'm not actually going to do it. Don't worry. Got it. I now understand. Okay, cool. Obviously, because this patient is a student, this is a demonstration, I'm not actually going to be injecting the student. We don't do that here. So I'll just show you where I would be going. So I'd go from the acromion process here to about 3 fingers down, and it'd be right about in here. So can you raise your arm? Yep. So that muscle is activating. I can feel it activating. So I would scrub right here. However, again, because this is a student, we're going over here. We're going to pretend that this is the deltoid. Oh, we would also do a Z-track, which means that all I do is pull the skin over and then inject and then release. And that kind of seals it in and makes it the medication access the muscle and not the subcutaneous fat and not a subcute route. Okay. We're going to use this guy again. We're going to rub. We're going to let it dry. I've already ascertained all the correct rights. Cool. Made sure that this is excellent, the right amount, and it's right there. Perfect. Cool. All right. Now that it's dry, I'm going to uncap my needle. I'm going to grab, and we're going to go straight at a 90-degree angle here. And again, we'd already be doing a Z-track, but this device is not big enough for a Z-track. So, all right, injecting 3, 2, 1, all the way down. Good. Doing great. 1, 2, 3. Good work. Okay, and then I'd recap this. Maybe there we go. Cool. And this is immediately going in the sharps. Okay. Rub. Make sure that this is not bleeding. This is good. If I need to, I could apply a Band-Aid. Doesn't look like the patient needs to at this time, which is great. Okay, so your breakfast is going to be here in the next hour and a half. If you start to feel, again, like shaky or weak or anything, that's when you use your call light to let us know what's going on. We're also going to just double check and make sure we're going to be constantly assessing your kidney functions and all this for the adverse effects of the Toradol. We have already went over the counterindications. I'm just lowering your bed down now. Okay. All right, you still in some pain here?
5 out of 10.
You're a 5 out of 10 now? Okay, good. The pain should go down as the Toradol continues because that Toradol is for the acute pain, okay? All right. Okay, I'm going to put up the appropriate bed rails. I'm going to give you your call light. I'm going to give you your possessions that you want near you. Do you need to go to the bathroom?
No.
Excellent. Great. Cool. Cool. And this position's okay for you?
Yes.
Okay, great. Cool. Then I'm going to go document, and your breakfast will be here shortly.
Thank you.
You're welcome. Bye. Okay.